Circumcision has many medical advantages and almost negligible disadvantages if done properly by trained, experienced people, and particularly if done in a very early age.
For thousands of years, circumcision have been one of the basics of the Jewish tradition. It was one of the first commandments for the Jewish nation. And I do have to say that through thousands of years of our history, Jews were ready to sacrifice even their lives in order to continue performing this commandment.
In Jewish tradition, circumcision is done on the 8th day of birth. A very young baby, who on one hand already has enough coagulation factors, which is unbelievable. It's exactly around the 8th day when the baby has its own coagulation factors. And on the other hand, his sense of pain is very, very low. In other words, there have been many, many papers done about the correlation between the age of a child and the perceivement of pain. And of course, as the child gets older and older, then the perceivement of pain is much higher, and the length of feeling pain gets longer and longer.
There is vast support evidence, what we call evidence-based medicine, based on highly significant, large population studies that have proven the benefit of circumcision in the prevention of sex-contagious diseases like HIV, herpes, that are infecting more often males, and there are some implications to females too. Males who are not circumcised, and there are some works that have proven less cervical cancer in women with partners who are circumcised.
I'm going to speak about the medical benefits of doing male circumcisions. One is at the younger age, is a reduction in the occurrence of UTI, urinary tract infections. UTI is a serious disease that can leave kidney scars. And we're talking about cancer. There's a significant decrease in the rate of penile cancer and even prostate cancer. So these are all huge benefits for the person itself. Now we're looking at the partner. Studies have shown significantly low rates of HPV infections, which leads to cervical cancer, low rates of bacterial vaginosis, and so forth. So we see that the benefits really are across the different stages of life to the person himself and to its partner.
The benefit of the circumcision is more hygienic, it's no irritation, no inflammation, and less transmitted sexual disease like HIV.
We are talking about diseases connected to not male circumcision, like urinary tract infection, like penile cancer, like cervical cancer of the woman, like diseases like AIDS or papilloma disease, and other sexually transmitted diseases could be connected with not circumcision.
It has been proven undoubtedly that circumcision is one of the best preventive and protective agents to avoid HIV and AIDS, and that is proven to such a degree that in Africa it is being done even to adults, so that the transmission of such a terrible disease will be avoided.
I'm a mother of 13 children. I have 6 boys, and I've gone through 6 circumcisions as a mother. I've also gone through 12 circumcisions of my grandchildren. I've gone through the process quite a few times. I don't have any remorse about it, and I think it was just the right thing to do.
It's very important to continue this tradition. I'm not sure that any kind of legislation or decree could compete with the desire to keep basically the commandment that kept the Jewish people as one nation for thousands of years.